Now you'll come across two COPD patients in OPD. One is pink, the other appears to be one appears pink, the other appears to be blue and bloated, or he slightly appears obese. So we'll see what is the difference between a pink puffer or a blue bloaters. Remember, these two are historical words. Okay, now usually these are kind of an outdated clinical terms, but they can be asked in viva by senior examiners. They are used to describe two extreme phenotypes of COPD. Pink puffer in a patient who is pink, it's usually the underlying disease is emphysema, and we all know emphysema is because the alveoli are destroyed in emphysema. But remember, his ventilation is relatively well maintained, okay, and his oxygen is near normal, and carbon dioxide is also maintained in a near normal value. And these two levels are still be able, like they are normal, because the work of breathing is very high in this patient, and he uses what is called a pursed lip breathing. Pursed lip breathing meaning like how you blow a candle, no, how the air comes out through your mouth. That's how these emphysema patients will expire. So that's why these patients are quite thin, because their work of breathing is very high. It's almost like breathing itself is like a workout for these emphysema patients. Blue bloaters refers to patients of chronic bronchitis. There is increased mucus production, and that leads to obstruction because of chronic inflammation in the bronchus, and their ventilation is poorly maintained. For that reason, they have hypoxemia and hypercapnia. But distress is quite less in these patients, and work of breathing is not as high as what we see in emphysema patients. But the chief complaint of these chronic bronchitis patient is productive cough, and these patients are slightly obese or they appear to be bloated. Okay, the reason, if you see here, see the right ventricle pumps the blood into the lungs. Clear? But what happens here, because of hypoxemia, the blood vessels are vasoconstricted. So pulmonary blood vessels undergo vasoconstriction. So they have what is called pulmonary hypertension. So the pressure inside the pulmonary blood vessels are very high. So patient is not able to pump the blood into the pulmonary artery. So the blood is not able to go to the pulmonary arteries and into the lungs for oxygenation, and the right ventricle will start enlarging. Okay, so the right ventricle will start failing, and there is right heart failure because of pulmonary hypertension. So that is why these patients will have edema in the lower limb. The right atrium is failing, there's a backflow, so there is fluid accumulation in the lower limbs and in the abdomen region, so they appear to be bloated. So this is